Welcome to All Things Locks. We have a special guest for you today. We have Renee Vee. She is a CCC-SLP, renowned speaker, author, columnist, conference co-founder, and mindset communication specialist whose work bridges the worlds between education, leadership, and personal development. She's a seasoned speech pathologist, language pathologist, excuse me, and Renee has dedicated her career to helping individuals and organizations strengthen communication, confidence, leadership, and culture. So happy to have you here. Excited to kick us off here. So I've heard speech language pathologist over and over in a lot of different areas of my life, but what is it for everyday people? Why is it important?
Speech pathology is the field of studying communication and communication disorders. And what that looks like is going through the curriculum of college and then getting your master's and graduating and doing a full year of an internship called a clinical fellowship year, which is called a CFY. So before you become a CCC, which you mentioned, that means Certificate of Clinical Competence dash SLP, which is a speech language pathologist, you are first a clinical fellow and you work underneath another therapist doing your job. You can get a job, but you need to be supervised and paperwork needs to be signed off by a certified speech language pathologist. So once you go through all that training, that year of training, and you get all your hours, then you apply to be certified and you can apply for your license. So that's pretty much what that is. The CCC-SLP means that you're certified, and the SLP means you're licensed. And speech language pathology, what pathology means is disorder, right? Like we are seeking to diagnose differences in speech or delays in speech or language. Those are two separate things that a lot of people don't realize. That
Tell me what that is.
Sure.
That difference. So we're on the same page. Yeah.
When we refer to speech, it means how we're producing our sounds. So like you mentioned about a lisp, that would be a speech disorder because it's affecting how you're producing your speech sounds. So, and what falls under the umbrella of speech could also be fluency. So when people have stuttering difficulties, that kind of falls under that umbrella of speech. Language, on the other hand, is a culmination of receptive, expressive, and pragmatic. So expressive language is what I'm doing right now. I'm speaking to you. I'm using good sentence structure. I use vocabulary. I define things. I categorize things, and so on and so forth. It runs the gamut of all like how we develop and how we're speaking. Receptive language is what we understand. So it's what we take in and process and be able to respond. So following directions, things like that fall under, listening to a paragraph and being able to answer questions about it, listening comprehension. That is all receptive language. And there's more, but that's pretty much how I explain it. And then pragmatic language is our social language skills. Teaching about perspective taking, how to volley a conversation. A lot of our children, especially on the autism spectrum, struggle with their social language skills. They don't understand, kind of their space in a conversation. Oftentimes they want to talk about what they want to talk about and not take into consideration, things like that is called pragmatic language. So all of those things I do.
So that's a gamut, so to speak, of skill sets. I think at least, for me, and kind of throw this over to Antonio after that, but if you're, when you're a parent, because I've had some patients who have had children with some of those challenges, and some of the feedback I've gotten is, I wish I knew sooner. I wish I kind of identified some of these. So what is the best way for a parent to maybe identify some of these challenges or concerns so they can get their child, if necessary, to somebody like you sooner rather than later?
I think it's awareness, just like most things. When we're I'm a parent, so I'm in the field. So for me, I knew my daughter was going to need speech therapy. So because she was falling behind, she couldn't say her THs, things like that, like little things, nothing huge. But she has also had other health challenges. So that I kind of was let me pick what's best for her right now, and she eventually got speech therapy. But my first instinct is to tell a parent, go with your gut. If you don't think your child is at the point where you think they should be developmentally, if you're comparing them to your other child, and which, at the same time, we shouldn't really be comparing them. They're two different humans. But if you saw a pattern with your one kid and then your other kid is not following that pattern, or it looks a little different, you might have questions and be like, why is this different? So being aware of that. I mean, we're gifted with the internet. We can find anything on there. So the Google machine is always where we go first. Now ChatGPT can tell you everything. So I think once you have a feeling, and with maybe you're second guessing yourself, always talk to, speech therapists are everywhere. Early intervention is a state funded service that from 0 to 3, you can get free, services. It's paid for by the state. So you just have to link up with an agency to get an evaluation. And I always say that if you have any concern, get the evaluation, because that's going to give you the answers that you're looking for, whether they're saying everything's okay and we'll follow up, or saying, okay, this child needs intervention. So, yeah.
Is it weird when you're saying like like you being, because you're badass. I've known you for a while. I went to school at Penn State, NYU. Like you're very seasoned, and then it's like my own daughter needs to have a speech pathologist. You're like, is it me as a parent, or like what's going on? So is this how much of nature versus nurture falls into this?
Well, that's a loaded question, because some disorders or kind of motor disorders can be genetic. Sometimes when someone is a stutterer, there's usually someone along the line that also is a stutterer in their family. It doesn't mean that you're doomed and that that's going to be how your life is. But I think because I have this heightened awareness of what my daughter should have been doing, it was minor. It wasn't anything that like raised flags for me as a therapist for as many years. I've worked with really severely disabled children, but I knew she needed a little push. But she's also a COVID kid. So they did she was in kindergarten learning online, and it just doesn't, you're not getting the developmental contact and social contact with people. So I expected her to be a little delayed in that sense. But then her academics, she wasn't up to par, with whatever their scores are. Yeah. And so I knew that. And I had requested an evaluation when she was before COVID. I was like, I told her kindergarten teacher, I think, if anything is raising a flag with you with Mila, let me know. I will request an evaluation immediately. And she never did. So I was like, okay, I guess my kid's good. I will see what happens. But over time, I started seeing the gap between where I knew she should be and where she was. So I requested an evaluation. She had the full battery done, and she's had an IEP ever since. And she has had an IEP is an individualized education plan. And that's what children who have, their learning differences or special needs, that's where they get specialized instruction. So, yeah, go ahead. Did you want to ask me something?
Well, yeah. What happens going into adulthood? Because it sounds like and correct me if I'm wrong, that it's things that people aren't, like, they don't know enough about. They're maybe not attuned to it, or maybe it's something that they just miss, or it's something that they do recognize, but they don't know that there's services or agencies or people that can help. What happens when that child continues on into the workforce? Because you mentioned earlier that communication could be severely impacted with something like this.
So an IEP, a child is given an IEP, and it runs till they're 21 if necessary. And what is included in that is transition services. So in fact, it's ironic you asked me that, because I'm now doing teletherapy with high school kids. So I've always worked with elementary age and middle school. So we didn't ever talk about, what happens when they're getting in high school and what's going to happen after high school. So I'm experiencing that right now for the first time in 24 years. And so I'm sitting on these meetings listening. So what happens is, you get your goals based on the evaluation that is done. So you can see where people are falling, where their strengths are, where their needs are. Then you formulate your goals based on that. Then over time, when, and we hit a certain accuracy with certain goals, we move on to another goal, or we retest every 3 years in order to see, okay, they started in this year, now it's 3 years later, where are they with the battery of evaluation testing that we do? And sometimes kids test out, and sometimes they need to continue service, and they might end up needing a little bit less. Maybe they're getting seen twice a week, for a half hour. Maybe we lower it a little bit, the frequency, to 1 time a week. And usually high school is not really, there aren't a lot of kids getting speech therapy in high school. They get social skills, that kind of stuff. But there are some kids that do need the service throughout their schooling, formal schooling career. And what happens is, in high school, when you have these meetings, the IEP meetings, the case manager, who is the special educator, I'm like kind of I'm on the team, but I don't drive the IEP. I just add to the IEP. They have post-secondary goals if you're 14 and up. So once you're 14, so basically a freshman in high school, you can get job preparation goals put in there. They talk more about kind of the most important things in life, which is what are your interests and what do you want to be, and how can we help you get to that point as a team.
So yeah, you're talking about transition care, which is definitely something that doesn't really get discussed, right? Like you said, there's a lot of focus on the child, and then they get older, and it's like, all right, like kind of what you have is what you have. But when somebody's making that transition to adulthood, and obviously want to spend a little bit more time on the children aspect, but they're in their 20s now, and they've gone through a ton of care, doing really well, but they still have some kind of, neurodivergent or communication challenge per se. What's a way that they can continue their process of thriving and really making sure that they're just living a very, I'd say a full life, to say you can't do that, but like really making sure that they're still progressing even when they maybe age out of a place where they can get some consistent care?
So it's definitely important to note that all of this is dependent and contingent on the functioning of the human. So there are, like, almost every student I'm working with right now doesn't need a transition plan. They shouldn't even be at, getting my service anymore, but there's been a lot of holes in the system where they have been carried through. So now I'm hopping on with 17, 18-year-olds in high school, and I'm trying to keep it interesting for them because they're like, I don't need this.
That was that was kind of a question too. Like, are they?
Yeah.
Their different maturity level, how they're responding.
I have so much fun with them because they're literally like cool kids. They just hang out with me, and I make it so we do more social type stuff. Like, we talk about what they're grateful for, like right now about Thanksgiving, and I talk about gratitude, and I do a lot of mindset work with them, honestly, because they need it. We all need it. So for me, it's been a little bit of a shift in how I present therapy because of their age and their level of functioning. So these children will graduate, will either get a job or go to school, trade school, whatever, and they will be fine in life. There are the other children pocket of humans who will probably always need help. And then there's the middle ground, who are kind of struggling, but can probably live on their own or get a job or things like that. And for those types, the middle types, they can certainly continue with language therapy, social therapy through agencies. There's a lot of resources out there that they can tap into in order to keep getting better and keep learning about. And when I say this, it's mostly social kind of stuff. And speaking properly, using a good sentence structure, using good vernacular, using good grammar and things like that. And that's kind of more of like a training where they could come to me and I could work with them. So it takes a savvy family to realize that their adult child can still use this kind of service. It just has to look a little bit different.
I like to switch gears over into mindset because it seems like when someone is getting coached or they're getting therapy on their essentially like their communication box,
Mhm.
their ability to speak to someone and doing it in the right way. You mentioned vernacular, you mentioned vocabulary, grammar, all that. And but there's a mindset component to it that really drives it. Like talk to us
Mhm.
a little bit about like the importance of mindset and also just like what your definition is because that term gets thrown around all the time by all different
Mhm.
types of people. I mean, David Goggins talks about mindset, but so does John C. Maxwell talk about mindset, and they could not be further apart. So, what is it? How do you look at it from where you sit being
Mhm.
an educator?
I look at it, there's a couple different categories of mindset, but the two main ones that I consider is growth and fixed. So there's going to be families, people that are not going to be as willing to put in the work to get better at whatever it is that's being put in front of them. Some people think, oh, I'm a stutterer, and they title themselves as that because they've been stuttering since they were 3. So they kind of associate themselves with being a stutterer, and there's nothing wrong with that. But what that does to your mind is say, I can't change. This is it. And that's couldn't be further from the truth.
Mm.
Because once you set your sights on wanting to not stutter, and this is just an example, then you can have fluent speech. It's a decision really to practice, to put in the work, to do the practice, to pour into yourself and find all the resources that you can in order to be able to get in front of people and not trip over your words. So when I say fixed mindset, it's people like that who just think, oh, this is just how I am. I just have bad grammar. It's just who I am. And for most instances, things can be changed with understanding that you want to change and put in the work to make the changes. Then there's the fixed mindset, no, the growth mindset, who knows that I can get better. I will get better. I should be getting better every day. Just because I stuttered as a 2-year-old or 3-year-old doesn't mean that I have to go into adulthood being that. It's not a life sentence. So when I say mindset, it's, are you willing to do the work? Because I speak just fine. So me talking to you is not going to help you get better. I can't get in your mouth and move your tongue and do all the things to make you say the sound right. And I say this to my kids very, very pragmatically. I'm like, you have to practice. Like you're going to have a lisp if you don't practice, and then people, as you get older, it becomes more habitual and you're unable to kind of reverse it because that's how your tongue has been going since you learned how to speak.
Here's a little fun fact. I actually used to have a pretty bad stutter growing up. If
Did you? I don't think
I'm
you
gonna
ever
go
told
outside
me
and
that.
ride my bike. Yeah. I used to have a pretty gnarly stutter, and I had like one of because growing up in Alaska, it's not like you're surrounded by a bunch
Yeah.
of like doctors and like educated people. I remember one of my dad's friends, Victor, R.I.P.
Oh.
Victor. He was just like, "Mijito, slow down." It's like, what are you trying to say? Just he was just like, slow down. And then I literally was like, I'm going outside to ride my bike.
Oh.
And I remember that like it was yesterday. Yeah. So I used to have a pretty gnarly stutter. Sometimes it'll come out like a little bit, but yeah.
Yeah, I hear it.
Yeah, every time
Well,
like
fun fact about that is that
repeat
everyone
again.
stutters. So you've tripped up your words, I'm sure. I've tripped up my words. Even inserting like ums and ahs can be part of a stutter. So when we think about how we all speak, there's times where we repeat ourselves, right? But when it's the type of repetition that kind of differentiates between what is considered a disfluency and what's just normal being normally disfluent. So like you said, like that is atypical, that requires treatment. But if you're saying I think, like that's a whole other ball game of disfluency that isn't necessarily considered atypical.
Yeah, yeah, that's me. So, when we're talking about, you said you put the emphasis on the child, right? You have to do the work. You can't want them to get better than they want it. But I know you talk about family-centered healthcare. So, I guess the question too is like, how does that work in terms of what's the responsibility, but what's the aspect of where the parents come in on this journey to support and guide their child to make sure that all right, they're doing the work, they're getting better, providing the right kind of help or support that they really
So
need.
I like to look at it like any other activity or sport that kids are doing. They go to practice. They don't just show up. I mean, maybe when they're 2, they just show up to the game and run around on soccer field. But,
Yeah.
but with anything, right? Anything that we do, we're only going to get better with practice. And I always say the funny story about piano. I said it to a parent last night. I said, don't treat it like piano lessons, like little Renee, who did not want to take piano or wanted to take piano, but didn't really care to practice. Like, I remember the lady would come to my house. We'd do the lesson, and then she would give me the homework to, practice over the week. I didn't practice. She would come the next week, and I would get in trouble because she would, you're not advancing because you are not putting in the work. It's because I wasn't interested in it. So this is something that when it comes down to it, depending on the age of the student, usually when they're little, they don't understand the importance of it. They practice with you, they leave, and they forget about it till the next time they're with you, typically. So it's very important that the parents right in there from minute 1, asking for the advice of how can I best help my child at home? Because there's another example I can bring up that you don't want to help your kid with, right? So here's a little side note. If you're working on with a child on a sound that they haven't kind of mastered in the room with you, you don't want to send home homework because 9 times out of 10, they're going to be practicing it wrong. So a lot of it is based on the level of the child and how they're progressing in the therapy. So I wouldn't give a lot of students homework in the beginning and the parents would ask me for it. And I've said, well, until I feel like so-and-so is solid in how they're pronouncing this, I don't want to send home homework because what is the point? There's no point if you're practicing it incorrectly. And that can kind of like backtrack you on the therapeutic process if they're practicing it wrong. But
Yeah.
yeah,
It's a saying in boxing, like it's not practice makes perfect, it's perfect practice makes
right.
perfect.
Yes,
What you
and
mean?
practice
Oh,
and practice means progression, not perfection. So we want them to be able to go from saying the sound individually to saying it in a word in all the positions, a phrase, a sentence, while reading, in conversation, and carry it over outside of the speech therapy room. And that's a mistake a lot of people make, is that they either expect too much of their child, like when I'm only working on just the placement for a sound, like TH, and the parents are like, say thermometer, and you're like, no, not yet. They're not ready for that yet. So there is a fine line between helping and harming, actually, the therapeutic process. So
when you when in working like with, let's just say, with adults, I know one of the things like you're an incredible speaker and you've done all types of really great podcasts, and I've seen you kind of in action, just yourself, that when you're working with adults, that can you tell like, hey, like they need to work on some stuff and it's impacting business, it's impacting a leadership
absolutely.
role, it's impacting their ability to communicate. um what's that process like with an adult who is just trying to be a better leader? They realize that, hey, maybe there was something in the past that's just been really ingrained in
Mm.
me. And at what point should they work with someone like you, especially if they're looking to progress into maybe speaking or themselves doing podcasts or taking on a larger leadership role and running better meetings and bigger meetings?
I've learned to not give a lot of advice unless I've asked. So if somebody,
Okay.
I have even some of my friends or acquaintances whose children need speech therapy, but I'm not going to sit there and on my soapbox and say, if they ask me, I'm very happy to chime in. but when it comes to unsolicited advice, it hasn't gone over well in the past. So I just kind of, um,
It's a tough one,
well, it
right?
is.
Like, hey, can you say your R's the
It
right way?
is. I
Yeah.
mean, I have a
Yeah.
cousin who has a severe lisp. I don't understand. He's my age. How did you get this far without wanting to? And I think you mentioned that before, Antonio, that people don't even realize that that's the
Yeah.
case. Then I've had other family members and or friends ask me for my advice, and that's what brings me joy, because I know they want the help, and I know that they're going to follow through with the help, because it's a two-way street. I give, you give. It's not just me barking at you and telling you what to do and then you leaving and not touching it again. It's a practice. It's something that needs to be kind of put into your schedule, into your day. So I think to I'm sorry, my email buzzer keeps going off. I forgot to turn it off. I think it's important for people to understand that if they are seeking help, help is there, but you have to be aware of it in a way. And I'm sure me calling attention to somebody could be like borderline embarrassing for them. So,
Yeah.
if
Yeah.
they've gone this far in life and haven't, sought out a service, chances are they don't even know that there's a problem.
Yeah. I noticed with some folks, and where there's a level of nervousness that kind of spikes them to have more of that speech
Hmm.
impediment. So like, for example, like, just a regular guy, when he's, let's just say he's an engineer or whatever he is, he's fine. But when tries to talk to a girl, or he's running a meeting or doing something, then it just comes out, and it feels like that's not a mechanical thing. It could be a mindset thing. I don't know, but for someone like that, where they have enough self reflection, where they're thinking, I need to work on maybe this
Hmm.
side of it, and it feels like when I get nervous or when I get stressed, it tends to come out. It's like, what should I do? Right?
So what I think you're referring to is disfluency, or is it something else?
Could be.
Because
Okay.
that's
No, I don't know.
that, like, as
Yeah.
soon as you say that they struggle in certain situations, I always kind of take it back to the disfluent person, because a lot of fluency therapy, stuttering therapy, is counseling. So in a way, I have a 13-year-old now. He's adorable, and it breaks my heart when he speaks, because I mean, think about it. You're 13, you're going to go to high school, you're going to meet new friends, and the last thing you want to do is not, hi buddy, is not be able to get your words out. So I think it's important for people to when if they're finding in certain situations they're struggling to communicate effectively, they have to pinpoint what that is. So I told this little guy the other night, I said, when you feel the most disfluent, what is going on? Are you tired? Are you excited? Are you nervous? Where's the kind of the source of the extra bumpiness, I call it? Like, why are you being so bumpy? And he knew, and so that to me helps me kind of tailor his therapeutic program to do, maybe presenting in front of class, which for most people is a nightmare. They'd rather die than speak in front of people. So to get that comfort level for a child like that, or even an adult, it's all the same, right? Whether you're a kid or you're an adult, it's all the same. It's just I'm able to speak a little more with higher level language with the adults. But for the kids, it's like,
Mhm.
you have to present something in class. Why don't you bring it in? Let's review it every time you come here. Let's record you doing it. And obviously, Antonio, you understand this, the repetition. It's almost like, putting it on a phone and listening to it over and over again to kind of almost memorize it, so your comfort level goes way up, because you know what you're about to say, as opposed to having to think about what you're going to say.
So there's and I love what you just said there. And there's this aspect of, as we improve on what we're struggling with, this ability to become more
Yeah.
confident, right? And where do you see this? Because that's a common question for just general people: is how do I become more
Mm-hmm.
confident? I know some people say you just got to do the work, but then there's the aspect that you even noted of that, confident people don't care what other people think. So I'm just kind of curious to know, as right, we develop these skills and you become how do you just build that confidence, and why is it really necessary for people to understand how to actually go about doing
Sure.
it?
Confidence is something that, gosh, I keep studying about because it comes up all the time. But it all goes back to your thoughts. So the people who come across confident, or maybe they really are confident, but some people can fake it really well. Like I've met a couple people who I thought were really confident, but in other situations I was like, ooh, there's something going on there that's not clicking for me. So as far as there's so many things I want to say. So when you are,
Say it.
well,
Let it out.
yeah, because
Say
you
it.
said,
Yeah,
Dan,
let it
because you
out.
said something about the confidence. I don't remember what you said. Anyway, let me go back to what I was saying.
That's
Yeah,
that's
that's
about
all
right.
right.
I mean,
Something about confidence. So really what we want to look at is the thoughts that are going through their mind, right? So our thoughts affect our feelings, affect our actions, affect our results. So if they're thinking, I can't, that's gonna manifest in how they present themselves on the outside. But what we can do is do the switch kind of thing, like Chris Patterson switch, where you're very aware of how you're thinking, and you're able to take a negative thought and turn it into something more positive, and then use it as an affirmation. So I've done this with my students too, and they love this because no one really calls attention to this when you're in school. So when you actually sit down and become aware of what you're thinking, and if those thoughts aren't serving you, then you can change them. So if you're not a confident human and you want to be a confident human, you have to present yourself as that person, even though maybe inside you're still a little shaky. I mean, I think I'm pretty confident on the outside, but lately I've been a little not confident. So it goes in waves, right? It's certain times you feel great about something when you're really solid, and other times you're like doomsday in your brain, and we're our worst, enemy inside. And most people are their own worst enemy. So when,
yeah, I have a lot of
yeah,
insecurity. I was gonna say a lot of insecurities in that aspect of, confident people don't care what other people think. We talk about that a lot in society, but where does that show up, so to speak, of I don't care what anybody thinks of me versus, all right, we all do and you should, but how do you still live your life with the confidence in who you are as a person while still being able to accept other people's perceptions or emotions that are directed towards
so
you?
that's what you brought up before that I wanted to touch on. So I'm glad you did it. So the confidence of, the kind of the stigma with confident people is that they don't care what other people think. That's not necessarily true. They just know they're solid within themselves. So they can receive other people's advice or guidance. And there's two ways you can handle it, right? Either I don't care what you say, I know what I'm doing, or wow, that's a really great thing. I'm going to think about that. But knowing inside that whatever that is may or may not work for you without hurting the other person's feelings. Receiving the information from someone else, even if you feel very confident in what you're doing. So like, let's say you wanted to give me advice about speech therapy. Well, I'm not going to be like, well, I'm the best speech therapist there is. So, there's no room for improvement.
Yeah.
That is, I feel like there's a line between being pompous and being confident in a way, because some people really don't care what other people think, but it's at the expense of their relationship with that person. For me, confidence is feeling good in yourself, presenting yourself that way, and accepting other people without any judgment. And I think judgment is what causes a lot of that kind of stigma towards confident people, because people who don't feel confident think they're being jerks or think they know it. Oh, she knows it all and blah, blah, blah. And which I'm sure all of us have had people talk behind our back. I mean, anybody who's doing something like you're doing, podcasting, if they're not in this world, they're judging. And it comes from a space of it's their own insecurity and their own lack of self-worth and self-love that comes across like a defense mechanism, really. Because instead of accepting how cool this is, what you guys are doing, which I completely appreciate, they're knocking it because they don't understand it, number one, or they're not confident with themselves. So speaking poorly is like their love language.
Yeah, that's a lot of people's love language, and we are cool, so yeah, screw that.
So one thing I saw that you talked about before was the myths that mindset work is just
No.
positive thinking, and going back to like there's indicators that people can give us that tell us what's going on in their brain. And one of the best ones, people talk about, body language, but it really is the things that they say. If they are, talking trash, if they are, saying things that are like they're a victim or woe is me, right? Like it's okay to kind of pick up on those cues. And so going back to what I said, myths, mindset work is just positive thinking. What's your thoughts on why you're saying like that's a myth where people think like it's just about being positive? Like what's kind of the shadow work behind that?
It definitely, yes, we want to have positive thinking. But if someone's on the struggle bus, just saying to them, just think positive isn't going to work. And in fact, it'll probably piss them off because they're in a state where they want help or they don't want help. I don't know, depending. But just telling them to think positive, what does that do? If you're not feeling positive, it's very hard to think a positive thought. So you have to go back and kind of reverse engineer it and start expressing gratitude for what you have. And that is a great tactic I use with my students too, is when I ask them what they're grateful for, I don't know. I'm like, guys, you're breathing. Be grateful. You woke up. Be grateful. I mean, I don't know what their home lives are. So they might have a lot going on, but they can be appreciative that they're in school. I'm like, you're in school. Be grateful. Your hair looks good. Be grateful. Like, and I'll make them laugh, but I'm like, you guys aren't realizing that you don't have to be grateful because your parents got you a PlayStation. It's more of like, I woke up today. I get to go to school. I get to wear these clothes. I get to eat a meal. I get to have hot water. All of the things that people just take for granted. When you're feeling low and people tell you to think positive, you're not thinking of all the blessings you have right in front of you in that moment. So all you hear is think positive, and then that person sounds like a jerk because they're not really understanding what you're going through, and they're just telling you, just don't be depressed. Well, that's a really hard thing.
It feels
yeah, like it almost is like a
understand.
jerk response. Like, well, just think positive.
Yeah.
But there's way more that goes into it. You could be supportive and hear them out. That way you can give them some kind of tactical advice about how to change how they're feeling. But just the think positive thing is not an answer to that situation.
One of the things I saw here was I remember you talked about the importance of making sure that you have micro wins daily. Can you elaborate?
Yes. Well, a micro win is what it sounds like, a small win. And no wins are really small, in my opinion. But when you think of it and as a micro win, you think the oh my gosh, I woke up, I got out of bed, winning. It's little micro wins are, oh my gosh, I got the stain out of my husband's shirt, winning. Silly things that happen all day long. I call them silly because people will think that this is silly, but there's a true science behind this, and feeling good about the little things in life, because then it brings more of those things into your life. So it is really something that is important for people to understand, that wins don't have to be this monumental, I won $1 million type of thing. It's the simple daily things. It's looking at my daughter with her braces on and smiling because she looks so adorable. It's, my son coming in and hugging me in front of others. He's turning 17. Like, that's a win for me. That's a win for me. But I've curated this, and I think it's important for that. This is a practice, something I didn't used to do. So it's not like all this automatically you just be like, oh yeah, I'm going to just focus on the little things in life. It's something that we have to choose to do.
Yeah, it's very easy to focus on everything that we don't have, and then just the negative aspect of ourselves. And I know this is really kind of going down about gratitude, but we were even just a few minutes ago talking about confidence, and I know, for me, just the stuff like you said, we take it for granted, and then we look at ourselves and wonder, why don't I believe in
Mhm.
myself? Why don't I have any confidence? And I know even when I was treating as a clinician, and patients would be saying, you're amazing," and I just be like, "Yeah, I'm good." And my wife's like, "What the hell is wrong with you? You're phenomenal at what you do." But it was just, this is what I should be doing now, right? This is what I went to
Right.
school for. So why am I congratulating myself on doing my freaking job? But then you realize how many people
Yeah.
don't do that stuff, right? It's like, not every doctor gets patients better. Not every chiropractor or speech pathologist helps their patients out. So when you don't take those things that are just, you think, automatic, it does actually, yeah, it makes you more grateful for what you have and for the work you put in. But then also, you know what? I got good skills. I'm doing good stuff too, and I'm making
Yeah, give
progress.
yourself credit, Dan. I mean, not everybody is good at their job, and not everybody has a bedside manner that people appreciate. So when I get a compliment, I'm like, this is amazing. Like, thank you. Because you feel like all that hard work and all that dedication you've put in as a human is being seen by the other human.
Mm. I'd like to kind of switch gears here. You have a role with Force Magazine, being
Hmm.
a columnist, and then also you're an executive contributor at Brains Magazine. And you mentioned that because of your experience there, you're actually launching a podcast called Mrs. Understood or
Hmm.
Misunderstood podcast. Tell us a
Yes.
little bit about
So
that.
that was something that kind of came about a couple months ago because I was hashing it out, masterminding with people. This is what I love about this space is you just get in a room with people that are kind of go-getters like you, and the ideas flow. It's more of like it's almost like the barrier breaks, the dam breaks, and it just flows because you're surrounded with humans that really do want to help you and see you succeed. And Antonio, we worked together for a while. Like, when you have that kind of relationship with people, your your outlook on things gets better and you feel justified in all the work you've done. So what Misunderstood came about in August, and I was talking to a friend, and we were at an event, and it was more of like a training, a mastermind, like networking and marketing event in Florida. And we were just talking back and forth, and she goes, well, she's like, those people that just feel misunderstood. And I was like, oh, that's a good name.
It
Yes.
is.
She's like, people just want to talk and feel seen and heard. And I said, well, I can do that. I do that all the time. So I said, but I don't have all the bells and whistles of hosting a podcast. She's like, oh yeah. She kind of walked me through, what she does. And she's very successful and has actual like a TV show. So I just started and I put it out there, and because I could, I could do this, and I can put it on a thing, and then I can send it to them. I can email them. I can make a little Canva, infographic for them to post and let it run its course the way it should, instead of me, kind of begging people to come on. I have all these amazing people all over the world contacting me. I'm very excited about this because I feel misunderstood in X, Y, or Z reason, because I've always felt misunderstood. So I get it. I get it. And
Yeah.
for me to be able to lend my ear and my little advice that I give, as opposed to like someone not feeling heard and not feeling seen by the world, it gives them an outlet, and that brings me joy to be able to give that outlet for people to talk about their experiences in life and be an ear for them. So that's something I started doing, and it's not like a consistent thing, but it's definitely something that I love, because it's sitting like just like this, having a conversation about whatever the topic is at the moment. And I just love people. So for me, like, meeting new people is, and then I've learned so much from them too in the interim, because they're all doing cool things in the world.
I love it. I definitely think you deserve it. Everything that, even what you were doing with Rudy Marr with
Yes,
Legacy
that's where
Makers,
it
right?
was. That's where
And
that's where I coined myself misunderstood because Rudy Mars said you need to name yourself, and I was like, what's my name? I don't know. Now it's
Misunderstood. There you go.
misunderstood.
But yeah, no, and I'm glad you're doing it. I think more people need to kind of see you in that space, especially in action when you're doing like micro coaching with somebody. I think it's very, very effective. What's one piece of advice that you would want to give to people that might be struggling with how they communicate their speech, and what's just like a positive note you want to
We're
leave?
just not alone. We are not alone. There is someone there out there that will help you. You can find people. There's 8 billion people in the world. You aren't alone. So feeling alone is a choice. Feeling alone is a choice. So once you get past, if you really want to do the work, you will find the people, the services, whatever it is that is going to get you to the next level, regardless of, how you're feeling. You need to be able to go out and say, I need help. Because the minute you say that, you'll get 20 people volunteering to help you. If you don't say it, they're not going to know. So they can't assume that you need help unless you ask. So I think being more verbal about needing help, getting yourself in rooms of people that are just like you, maybe in your business, or maybe just other entrepreneurs, or maybe they're all doctors, whatever it is, whatever your group is, find those people, get advice from them, and use their people. You're just never alone. And I think that's what I want to leave here is reach out to whoever you can. There's going to be someone who's going to help you in whatever way, shape, or form you need.
I love it, Renee. Thank you so much for jumping on. It was such a
Thank you,
pleasure.
guys.
Thank you.